Hello, and thank you for inviting me to speak with you this afternoon. This is a wonderful forum, and I'm thrilled to participate with so many remarkable leaders who are so dedicated to delivering care, advancing policy, providing education, and advancing innovation in today's rapidly evolving healthcare ecosystem. I'm the Vice President at Telus, a company best known for our globally leading wireless and wireline services. Now, you may be wondering why someone from a telecommunications company is speaking to you today about adaptability and innovation in healthcare during a global pandemic, no less. Well, we've been in healthcare IT for more than a decade, and we're in fact the largest healthcare IT company in Canada. We're in the business of connecting people and moving information securely, critically important and relevant for healthcare. We've been on the journey to transform healthcare and improve healthcare outcomes for all Canadians for more than a decade. While our competitors were investing in media companies and sports teams, we chose healthcare. We knew that healthcare needed help and that governments couldn't be expected to manage the growing demand on their own. And we knew that the public sector needed more support. As an organization driven by our social purpose and committed to leveraging technology to improve outcomes for all Canadians, for us at TELUS, it was a natural next step to explore opportunities to truly innovate in healthcare. So far, TELUS's investment in healthcare has reached more than $3.2 billion. And we're focusing on improving communications and efficiency, revolutionizing access to healthcare, and fostering healthier communities. Our world-class technology is enabling connectivity across Canada, and especially within the healthcare system. At TELUS, we're working hard to overcome socioeconomic and geographical barriers. We see the purpose there. We see options and opportunities, believing always that the very best healthcare should be available to all Canadians equally, wherever and whenever they need it. So as a result, we've developed technologies that complement our healthcare system. We've worked in tandem with healthcare providers and government to increase access to care, to improve the health outcomes of Canadians, and to enhance traditional physician and patient relationships, all the while safeguarding personal health information. We're not only focused on the future of healthcare, as many others seem to be. Rather, we're helping to drive improved health outcomes for Canadians today. So much of what's talked about in healthcare centers on pilots and small-scale initiatives. In actuality, the healthcare community has come a long way, and we've developed innovative solutions at a broad system level. And I think it's time that we need to recognize and celebrate that, and then continue to build upon it. Collectively, we are all changing the way we communicate and deliver care across the healthcare continuum. And for our part at TELUS, in addition to investing in technology, we're advocating for better access to health information and care. And we believe that ultimately this is what is going to help us build stronger and healthier communities into the future. Slowly but surely, healthcare systems in Canada have adopted technologies that are going to allow for a more seamless flow of information. There's still fax machines out there, okay? But I'm trying to get rid of the fax machines. But there's been a lot of other work that's been underway. Patients, physicians, pharmacists, and other healthcare professionals, they really are more connected today than they ever have been before. Our TELUS Health Exchange platform leverages various tools from our own portfolio of offerings and those from our partners to allow healthcare providers to communicate across primary care settings, as well as manage the security and privacy that's so critical to health information and to ultimately improve care delivery. As many of you in this room will know, electronic medical records, digital prescribing tools, pharmacy management systems, all of these are designed to support providers to help manage clinics and practices and to help put the focus and patients at the center of care. Over the years, virtual care became an area of great interest for us as we learned more about the real challenges that Canadians experience in accessing care. And this has never been more important than it is today as the entire world faces the greatest health threat in the century. When we were looking at virtual care, we were thinking more about people that didn't have a family doctor, people that are looking for care that are outside regular hours, weekends, holidays, and the like. But certainly the global pandemic has pushed us to realize that this service delivery model needs to be in place permanently to allow for proper level of care irrespective. The pandemic really did force us to rethink our approach to healthcare in Canada. And indeed, this has happened all over the world. We've all been put to the test of adaptability, and innovation is a really critical part of successful adaptability. Whether it's in our personal lives, in our work lives, and even in society, adaptability is probably one of the most important skills that we need to continue to develop. With the onset of the pandemic, policy and delivery shifted in a matter of weeks. Most notably, governments responded by opening virtual care fee codes across the country, allowing physicians to bill for remote patient consultations. Antiquated policies modernized almost overnight, one by one. Each province followed suit out of necessity. Necessity became again the mother of invention, as people desperately needed to see their doctors for care, but were not able to do so with COVID-19. Stakeholders across the healthcare community, they came together to meet the unique and rapidly evolving care needs of Canadian families, employees, and communities. And stakeholders were themselves also facing the pandemic like everyone else at a personal level. I think at times we feel that the people that are taking care of us, all of the healthcare providers, they're doing their job and we really need them to do their job. I think it's really important, though, that we all recognize that they are people too. They have families too. They are also facing an unprecedented pandemic, and we're all figuring this out as we go in many respects, especially as it relates to the level of stress and how to manage that stress together. COVID-19 acted as an accelerator for digital health solutions that enable care providers to engage with patients at home. And as an organization committed to driving improved healthcare experiences, supporting healthcare professionals and the public, and taking care of communities where we live and work, we felt and still feel a profound responsibility to do our part. We can, and so we should. And Telus is extraordinarily well positioned to lead the market in that regard. Thanks to our leading networks and breadth of products and service offerings, we're contributing to flatten the curve by increasing efficiency of care and keeping thousands of healthcare professionals, families, and individuals, including our precious Canadian seniors, healthy and safe at home. Our Telus Health team is leading efforts across the entire healthcare ecosystem in many ways, and I'll describe a few now. First, we're supporting COVID-19 screening virtually, reducing the risk of transmission. Then, we're supporting clinicians to allow them to monitor people at home so people don't need to be in the clinical setting for everything. Next, we're enabling safe and independent living with dignity for our seniors who are isolated by the pandemic. And then we're enabling virtual care through on-demand virtual consultations with a variety of healthcare professionals. So first, as Canada's leading provider of electronic medical record solutions, or EMRs, we're really committed to working with physicians across the country to ensure that they've got the tools and resources necessary to meet the current and future challenges that we see. In terms of detection and triaging, and with the introduction of virtual fee codes, we accelerated the development of our EMR Virtual Visit, a seamlessly integrated virtual care functionality that further reduced the risk of healthcare professionals and patients alike, catching or spreading the virus. And so in a matter of weeks, and thanks to the ingenuity and effort of the teams, we enabled more than 26,000 physicians across the country to be able to conduct secure virtual visits with their own roster of patients, access health information, and update their health records simultaneously right from their EMR. So we wanted to make sure that they had that virtual care technology to be able to support their own patients. And that's really, really important as we look to improve access to healthcare across the country. The video feature, it also allows physicians to observe patients' breathing patterns, body language, and physical appearance, so that if necessary, in their clinical observation, they can fast track or triage seriously ill patients to hospital emergency departments if required. Second, and speaking of hospitals, in the wake of the pandemic, we expanded our home health monitoring solution. So this is where nurses and other healthcare providers in British Columbia, they can digitally monitor patients remotely while they recover from COVID-19. That service that we had was based originally on people that have COPD or congestive heart failure and conditions like that, so that we could monitor them from afar, working with the ministries of health, etc. But we quickly needed to pivot that to allow people that have COVID-19 now to be monitored at home. We launched that in partnership with the BC Ministry of Health and the local health authorities. And essentially, there's a digital dashboard there that allows healthcare providers to track symptoms, provide medical help for more patients as they recover and outside of the hospitals in the comfort and security of their own homes. So by enabling clinicians to remotely observe the vitals of patients with COVID-19, as well as those who are vulnerable to the virus, and to provide the necessary interventions early, we can help to further alleviate the pressure in hospital emergency rooms and clinics. And we knew at the beginning of the pandemic that that was going to be absolutely critical. Supporting safe, independent living for seniors remains an integral part of our commitment to communities, and honestly, now more than ever. Our Canadian population is aging. Many of you will know that. And Stats Canada says that, there's about 6.5 million Canadians that are, aged 65 or older. Some might argue that 65 number should probably be bumped up. But by 2036, there's a projection of more than 10 million seniors in the country. And seniors, they want and they deserve to be in control of how and where they live, and they need to be able to age with dignity. And I think many of you would probably agree that globally, we've generally let down our precious elders when they have needed our care the most. There's so much work that needs to be done in this space. And I know there's a tremendous amount of collective effort underway to pivot and to adapt quickly as we learn through the pandemic. But there's lots that we can do today, and there's lots yet to be done. Without a doubt, it's probably one of the most concerning times for our older Canadians and for their loved ones and caregivers. The digital technologies that we have at Telus and that we continue to develop, they allow seniors the freedom of choice to age independently at home for as long as they can and for as long as they want. We are the largest Canadian-owned provider of personal emergency response services. And to demonstrate our care and commitment, especially during a time where caregivers may not be able to visit as often as usual, we're making our services even easier for Canadians to access. Our Telus Living Well Companion service is a 24/7 personal medical alert service that provides access to emergency support through the push of a button or with automatic fall detection, and it's available across the country, 365 days a year in both English and French, and I'm adding more languages as we speak. The national expansion here, empowers Canadians who are at risk for a fall or medical emergency to live independently as they age. It gives them and their caregivers peace of mind to know that they're not alone when they need the support the most. And certainly we've seen an exponential demand on those services with the pandemic. So next, consultation and treatment is no longer confined to the doctor's office. Everybody knows and probably has experienced that. From the safety and comfort of their home, more and more Canadians can now access video consultations with healthcare professionals. They're on demand, and they leverage our one-on-one virtual care solution. We know that most routine health needs don't disappear in the face of a pandemic. And we knew the anxiety that it created for a lot of people, not knowing how they were going to get access to their care. But through the use of technology and with the hope of alleviating some of the immense pressure on the public health system, our Telus virtual healthcare solutions like Babylon by Telus Health and Akira by Telus Health, they are already ensuring Canadians can receive quality care wherever it's safe and convenient for them. Our Babylon by Telus Health service is a virtual healthcare service for consumers. It launched in British Columbia over a year and a half ago, and it lets patients connect virtually with a locally licensed physician for non-emergent care when they aren't able to make an appointment with their own family doctor or if they don't have access one, and there's no cost to them. We know that there are in the country 5 million Canadians at least who don't have access to a regular family physician. And we know that all Canadians, probably 50% of all Canadians, have difficulty accessing after hours primary care. What do you do at 6 o'clock if you get sick or if your child gets sick? Where do you go? You have limited options. You could go to the internet and try and, talk your way through it. You can, phone a friend. You can, maybe go to an emergency room and, wait several hours for support there. Your options were always limited. And in those options, if you had a regular family doctor, they didn't really know what was happening with you. So there wasn't any real continuity of care. With our service, patients can also meet with counselors and registered dietitians to optimize their well-being and to address areas of concern. Since the onset of the pandemic, we worked very closely with governments in BC, Alberta, Saskatchewan, Ontario to bring greater access to quality care through Babylon by Telus Health. So today, to over now more than 25 million Canadians across the country can get access to our service, and I'm launching in Quebec as we speak, and as we head into the wave 2 of the pandemic, and we are very aware of the growing need for more support solutions in that province. The service is designed to be complementary to existing health services, and it supports the traditional doctor-patient relationship, providing access to care when it's convenient to the patient, and ultimately helping to free up some physicians in local emergency rooms, for example, so they can stay focused on those who actually do need urgent care. Babylon by Telus Health also empowers patients to play more of an active role in their own care. All the consultation notes are written for them in plain language, and they have access to them, helping patients really better understand their own conditions. Respecting the importance, again, of the continuum of care, our patients can choose to have their consultation notes and lab results, et cetera, shared with their regular physician for follow-ups. And most of our patients are doing just that when they do actually have a family physician. So we are improving and connecting the continuity of care that we know is so essential. And Babylon by Telus Health also has several features that enable users to manage their health proactively right from within the app. We have a service called Health Check that we just recently launched. And it's free. It's a digital assessment tool that enables users to learn more about their health in order to make positive lifestyle changes, preventative care. They're simply answering questions about their lifestyle and family history. It generates a health assessment that provides them with practical insights to stay healthy, including disease risks and other long-term health insights. And it takes about 15 minutes. And we encourage all of our users to leverage that amazing service. We also offer Kira by Telus Health, and that's our virtual care app, which is available nationally to Canadians. This one's available through employers, and it covers more than 1 million lives. The demand from businesses for this type of service for their workforce has grown so quickly that in the first month of the pandemic, we saw our customer base here double. Now, this service is delivered through a combination of text messaging and encrypted video, and employees and families, in this case, can benefit from personalized consultations and mental health support with Akira, which is really important when so many people are experiencing higher than normal stress levels as well. So that one's focused on employers. Critically, virtual care solutions like Babylon by Telus Health, they help people with after-hour care needs. They help those that don't have a regular family doctor. They help to free up critical capacity in hospitals and clinics. And most importantly, they offer care and reassurance to all Canadians during this very stressful time. We've seen exponential growth across our solutions, including Babylon by Telus Health. That user base is on track to increase 5-fold by the end of this year in a couple months. People are seeing the benefits of virtual care, the convenience, the ease it offers, the very high quality of doctors and the care that they can provide. And they don't want to go back to a time when this wasn't available. For our service, we ask our patients after every visit to rate us on the quality of care and quality of service that they've received. Tell us how the doctor did. Tell us if your needs were met. Tell us if they weren't. And after well over 100,000 video consultations that we've conducted with patients, our average quality rating remains 4.9 out of 5 by our patients. And for me to be able to scale up this service to meet the demands of Canadians in such a rapid clip and at such a critical time making sure that we are preserving and managing the quality at the highest standard that we have met in the past, and continuing that has been of paramount importance, and I'm really proud of that. We still, I think, collectively have a lot of work to do, though, when it comes to offering the kind of virtual care that other countries offer today. According to Canada's Virtual Care Task Force, some of the solutions that they put forward to improve virtual care in Canada that I agree with include things like a national standard for accessing patient health information, a framework to regulate the safety and quality of virtual care, the incorporation of virtual care in medical schools and continuing education, and increased support for regulatory bodies to simplify the physician registration and licensure processes. Those processes are still very antiquated. Driven by both need and consumer demand, these additions to the system need to be implemented as part of a smart strategy where governments and providers work closely together for the benefit of all Canadians. Overall, our virtual care services are key in ensuring that through this crisis and well beyond this crisis, the healthcare system capacity needs to continue to care for people who need it the most. And in that sense, I believe that they truly exemplify our social purpose, our social purpose in action. Everything we do at Telus is driven by our social purpose to improve connectivity and enable social and digital equity. Beyond just investing in technology, we're committed to giving back to the communities that we call home, and we've already dedicated $150 million to support COVID-19 relief efforts. And some of the examples of where that has gone and what do we put it to? We've expanded the Mobility for Good program to support frontline healthcare workers at hospitals in areas that were hardest hit by COVID-19 across the country, and we will continue to do so. We donated over 13,000 devices, tablets, SIM cards, valued at over $5 million to help isolated seniors, hospitalized patients, and vulnerable Canadians stay connected, because at the time the pandemic hit and hospitalizations started to increase, people became more and more isolated. Those people who were in hospital, not just COVID-19 patients, but everyone else that was in the hospital were, no longer permitted to see their loved ones, or at least, maybe there was one person that could come to see them, and it would have to be the same person in many hospitals. In long-term care facilities, I think everyone here is very well aware of what that has done from an impact perspective. The social isolation, limiting people from being able to go in and seeing their loved ones during their final years. So many of our precious seniors have passed away alone, and providing some of these connectivity services and iPads in long-term care facilities is the least we could do to make sure that people can stay connected. We've supported communities with medical technology and equipment through a $10 million commitment from our Telus Friendly Future Foundation. And as part of our Telus Health for Good program, we work with community partners across the country. We repurposed 6 out of our 11 mobile health clinics that are powered by Telus Health that typically deliver care to Canadians experiencing homelessness to serve as mobile COVID-19 assessment centers. And I'd like to share a little bit more about our mobile health clinics with you. Through our mobile health clinics powered by Telus Health, we aim to help some of the nearly 235,000 Canadians who find themselves homeless each year. The clinics are as a result of an innovative partnership approach between us and the community and physician leaders across the country. In BC, the community leaders included Fraser Health, Vancouver Coastal Health, Doctors of the World, and Victoria. And together with each partner, we've built a customized model of primary care outreach. This is to ensure that marginalized and at-risk citizens have access to healthcare that meets their unique needs and circumstances. They need healthcare, and they need it where they're at. We can't expect everyone to just meet us where we're at and come to us to see us for healthcare. The clinics reach citizens in need by breaking down both physical and mental barriers that are there to access proper healthcare. Operated by our dedicated partners, the mobile health clinics powered by Telus have already provided medical support in Vancouver, Surrey, Victoria, Calgary, Edmonton. We're in Kitchener-Waterloo, we're in Ottawa, Montreal, and Halifax, coast to coast, and I only have plans to expand that service. Earlier this year, announced a $10 million investment with this national program over the next 5 years. And that's going to provide over 20,000 medical and social interventions every year in the communities where we live, work, and serve. Last week, we're really proud to announce our latest innovation to support the health and well-being of our frontline workers in Canada who have given so much to their communities throughout the pandemic. We know that frontline workers also often feel isolated and alone in dealing with mental health challenges, and I'm speaking specifically about frontline healthcare workers. With Esprit by Telus Health, we can help support them in breaking down those barriers and provide them with a platform where they can confidently and confidentially access the support that they need. We developed this in conjunction with first responders and under the guidance of specially trained clinicians who are occupationally aware, people who understand the needs of frontline workers. Esprit by Telus Health provides timely access to features and tools for mental wellness, as well as support for crisis and for prevention. Our goal is to continue to work closely with organizations to incorporate Esprit by Telus Health into their mental health strategies with eligible frontline workers and allowing them to get access to the app through their employer or member organization. So what does the future hold for Telus in health? We're looking forward to continuing to work collaboratively with partners across the healthcare ecosystem. We want to expand the reach of our virtual healthcare offerings to even more provinces and territories in Canada, as well as to more employers that are looking to provide their employees and families with access to healthcare professionals and additional support. I want to deliver even more innovations that help empower Canadians to play an active role in their health. I want to give them more digital tools for health coaching and management, more mental health support, and overall wellness. And we want to further enhance our Telus Health Exchange platform to continue improving connectivity across the healthcare continuum. I think, it bears to be said that, along with the COVID-19 healthcare pandemic, I believe we have a mental health care pandemic as well. And I think that we don't even know what that's going to look like yet into the years to come. And it would behoove all of us that are in the healthcare space to make sure we do everything that we can to improve the mental health care support that is out there for all of us. And I mean all of us. So Telus, we've been pretty busy helping with changing healthcare challenges and needs across the country. We've been pivoting and adapting to the emerging and unmet needs of our fellow citizens. We've been connected to stakeholders, including government and health authorities, doctors, nurses, and patients. We really do believe that we need to work together to solve these challenges we all collectively face. No one has all of the answers on what is the perfect solution. I think we need all of our voices to be heard. Our hope is that no one's left behind. And that's why we take a broad and long view when it comes to health, as we continue to innovate and invest in healthcare and help our fellow Canadians. Every single day, I see the power in connectivity and connections. I see what it means for Canadians to be able to talk to each other through the miracle of our high-speed fiber optic cables, sharing information and ideas. I see what it means for the brightest minds in healthcare to connect and to communicate, to improve patient care. Technology helps us. It enables us to meet the healthcare demands of a growing and changing Canadian population. It allows us to create better and more efficient ways to manage health issues. It grants us efficiencies that open time up for people to focus on what matters most, which is patients. And as a community, our ultimate goal has always been to give patients the best care possible and to treat them with fairness and in compassion. It's complicated and at times overwhelming. It's an overwhelming situation for all of us to address, but we like challenges at Telus. And with the help of our partners, stakeholders, and many people who are in this virtual room, we are succeeding. We're adapting, we're innovating. Where we make mistakes, we're correcting, we're pivoting again. And that's going to be our continuous journey. Thank you so much for following along today on our Telus experience to transform healthcare. I really appreciate the opportunity to be here. If you have any questions, please go to the virtual room and ask there. Thanks